This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
Good afternoon, everyone. I'm Renee Summerauer with the Las Vegas Review-Journal. We're getting ready to hear from the Southern Nevada Health District about a new recommendation that everyone has probably heard, including those who have already been vaccinated against COVID-19. Wear a mask in crowded indoor public spaces. The new recommendations were announced this morning as COVID-19 cases continue to rise in Southern Nevada. Let's take a listen.
268,000 cases of coronavirus reported here in Clark County, and also that we have seen a steady increase in the number of cases reported here in the last few weeks. Regarding our vaccination campaign, we have initiated the vaccination in more than 1.1 million residents in Clark County. And we have more than 947,000 people already fully vaccinated here in Clark County. Regarding the distribution of this vaccination, right now we have 64% of the adult population, meaning those who are 18 years old and over, who have already initiated the vaccination here in Clark County. And when we look at the whole spectrum of the eligible population in Clark County, we see starting at 12 years old and over, then that percentage of vaccination goes to 58%. Despite those levels of vaccination, still we are suffering for this recent increase in the number of cases in Clark County. Because of that, today the Southern Nevada Health District is making the recommendation that both vaccinated and unvaccinated individuals should wear masks when they are in crowded public settings. And by those crowded public settings, we are referring essentially to indoor settings, such as grocery stores, malls, large events, and casinos, as a step to fully utilize the tools that we have available to stop the pandemic. So we still are working strongly in our vaccination campaign, and we are offering the vaccination at multiple sites in the community, and we are expanding even more further within the community the vaccination opportunities. But that's not enough today if we want to completely decrease the recent surge in the number of cases that we are experimenting here in Clark County. The use of masks correctly actually have proven to be to be effective in helping prevent the transmission of COVID. We want to say that this is a recommendation from the Southern Nevada Health District. It is not a mandate, but it's something that we are sharing with you and sharing with our community, because we need the collaboration from all our community members and as well as the business community here in order to make this effective, so we can completely decrease the number of cases that we are seeing right now. I will stop here, Corey, for questions.
As mentioned before, today we will take one question from each member of the media. If you'd like to ask, please raise your hand at this time. The raise hand feature is at the bottom of the participants list, or hit *9 if you're calling in. Our first question today comes from Mary Hines. Go ahead, Mary.
Thank you. Yeah, I was muting and unmuting there for a moment. Good afternoon. Is this a measure designed to protect people who are unvaccinated or people who are vaccinated? And is this a step in the direction of mandating a mandate? Do you envision mandating rather the wearing of masks? Do you envision that happening?
Okay, thank you, Mary. Well, this is a measure that directed to protect all individuals here in Clark County. The main target is, of course, the unvaccinated people, because they are the ones who are at higher risk of transmission of the disease right now. And our data shows that more than 95% of the cases and admissions that we had recently here in Clark County are people who have not received a single dose of the vaccine. So that's our main purpose. And regarding a mandate for that, at this point we are making this a strong recommendation to the public and our business community, and it's something that we could consider with the local authorities contingent to what is the response that we see in the next few days. Thank you.
Our next question today is from Astrid Mendez. I'm muting you now.
Well, doctor, for some people, this seems kind of like a setback because unfortunately there's a misconception that if you have vaccinated, you are basically protected from COVID at all. So the fact that, that now people will try to follow this recommendation, some people obviously are against it. So will this mean that, it could be a more dangerous situation for everybody?
Thank you for your question. Well, it means that we want to ensure that there is a better protection for everybody in this community. One of the challenges with the current recommendation from the CDC for vaccinated individuals is that nobody has the authority to actually ask a person who is without a mask whether this person is vaccinated or not vaccinated. So it creates a challenge, especially when in a situation similar to where we are right now, and where we know that there is an increase of transmission in our community. And we know that we have a relatively large proportion of our residents who are not vaccinated. So in order to make sure that we are decreasing the possibility of transmission of the virus, especially on indoor setting, that's where it is more easily transmissible, we consider that we need to come with this recommendation just to make sure that everybody who is attending any of those public settings is at least decreasing the possibility of transmitting the virus to those around them if they happen to be symptomatic, but even people who have no sign or symptoms, still, if they are infected, could transmit the infection to people around them. So just because we have this high proportion of unvaccinated people here and in our community, at this point, we consider it's important to request that use of masks until we see our numbers decline and the vaccination goes up. Thank you.
As we continue to call on you, be sure to identify which media outlet that you're representing, please. Our next person is Joe Moeller.
Yeah, this is Joe Moeller from Channel 8 in Las Vegas. Question here. You just mentioned you're going to be monitoring this over the next few days, the response that you're going to be getting. What will it take, or what is the next step, or at what point could you see the Nevada Health District actually implementing a mandate?
Thank you for your question. Well, in order to implement a mandate, that will require the active collaboration from the local authorities, meaning the county or the state or the cities. The health district itself doesn't have the authority to implement a mandate of this nature. So that would be something that we have to be in collaboration with the local authorities here. Thank you.
Our next question today comes from Caitlin Newberg. Trying to unmute you, Caitlin.
Hello.
There you are.
Okay. Hi, everyone. My name's Caitlin. I'm with the Review Journal. So what is the health district's data and modeling looking at right now as far as how high the disease metrics could rise, and when could we expect the metrics to start going down again? Is it just a matter of more people need to be vaccinated?
Okay, thank you for your question, Kathleen. Well, our numbers so far it show a positive trend, meaning that the expected number of cases is going up. We have some modeling data also looking at few days ahead from today, and that model still shows an expected increase in the number of cases because again the capacity of transmission of the virus, the way that it is estimated still is over one, meaning that the virus at this point in Clark County is able to reproduce more than one at a time. So that's a positive trend. I guess that was the question, right? Corey, did I miss something?
I'm not sure. Caitlin, re-raise your hand if we missed the gist of your question, and then we'll come back to you. Our next question today comes from Jacqueline Schultz.
Hi, doctor. How can you describe for us how hospitals are doing? And then in terms of handling cases, and then in terms of all the new cases, how much are young people? And are we seeing the Delta variant perhaps affect younger people more severely than typical? If you could give us an idea of how this is playing out among populations here, in and out of the hospital.
Okay, thank you, Jocelyn. Okay, we're looking at the data with the hospitals, and actually we have met with the hospital leadership this week, actually twice, and have been talking with them about the situation, just to make them aware of what the health district is looking at, and share information with them about the incidence of the disease, our expectations, and also looking at from the hospital side, what are the needs and expectations so far. So, but what we are seeing is there is a mild increase in the number of hospital admissions related to COVID in our community, but that increase is not at the same level than the increase in the number of cases that we see in the community, and it's not similar to the increase on the number of admissions that we saw during the winter or summer. Having said that, also I have to tell you that at this point today, our hospitals are working at a good capacity. They are not at risk of being overwhelmed by the admissions related to COVID as today. They are performing the usual practice, but they are looking closely at this situation. Regarding the younger population and Delta, what we are seeing in Clark County is that most of the cases that we are reporting every day are younger people. Most of them between the 18 up to 45 years old. Also, again, what we're seeing is that most of those individuals that are being diagnosed with COVID today are not vaccinated. And that's a big challenge for us because right now our vaccination campaign, our efforts are being directed towards that specific group. We are trying to work in new communication tools and new ways on trying to engage that segment of the population. That right now, again, that's a big challenge, and we are trying to really gain grounds within that group. But we also the county, the cities, the state, we are looking at different ways on how to bring the vaccination campaign deeper into the community, but also more easily accessible to the population at large, but with an emphasis to that younger segment of the population. Thank you.
Since today's media briefing is shorter than usual, in a moment we will move on to the Spanish language portion. If you are with the Spanish language media, please raise your hand at this time. In the meantime, here's the other part of Caitlin's question. She asks, do you have any idea when the disease metrics could decrease again, or what would have to happen for the trends to decrease?
Oh, okay, thank you. Okay, at this point, we don't have any evidence of when the current trend in the number of cases will decrease. So we don't have that level of forecasting available. So the answer is no. We don't know that will happen. And in terms of what we are going to do, well, precisely what we're doing today with this recommendation for the use of masks for vaccinated and unvaccinated people in public settings, mostly indoor settings. That's one of the steps that we are looking into that mitigation, and of course, contingent to how we see the progress of the disease in the community in future days and weeks. There could be additional measures if that's necessary. We also are pushing for our vaccination campaign, and the farther that we advance in our vaccination campaign, the better off we are in terms of decreasing the risk of transmission of COVID in our community. Thank you.
Thank you, Dr. Leguen. We do have a question from Alejandra Ochoa. She's raised her hand. But first, did you want to give an overview in Spanish?
Okay, so, we'll start with Spanish.
Thank you, sir.
Buenas tardes. Mi nombre es Fermin Leguen, director de salud.
You just heard from Dr. Fermin Leguen with the Southern Nevada Health District about the new guidance that everyone in Southern Nevada, including those who have been vaccinated, to wear a mask in crowded public spaces. We will have more on this story online at lvrj.com, and you will have these updates and more of today's events tonight at 7 p.m. You can also download a free RJ mobile app to get breaking news alerts sent straight to your phone. And of course, you can find us on Roku, Apple TV, and all of your favorite digital platforms. I'm Renee Summerhour. Thank you for joining us.
You've been watching Breaking News from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.